This is Persistent Pain Education 2, How to Manage Pain, part of the Prairie Primary Care Network Persistent Pain Program. Let's start with a quick review of persistent pain and an introduction to ways of managing it. If you didn't watch or attend Pain Education when pain becomes persistent, this video will be a quick introduction to persistent pain. Now, press pause and watch 3 minutes to think about chronic pain. You can watch the video at the address on the screen. Note: stop the video at 3 minutes and 18 seconds, as the information that follows does not relate or apply to the Prairie PCN Persistent Pain Program. Take as much time as you need. Press play on this video when you are ready to continue. The topics that will be covered today are: what is self-management? Why is it important? A pain-centered life versus a function-centered life. The Pain and Me video. Self-management tools. Self-management goals. And finally, changing our pain experience. Self-management is consciously using strategies to cope with and reduce our perception of pain. Self-management involves accepting that pain is part of our lives, learning about ways to cope with pain, and trying new tools and strategies to manage pain. We have a choice. We can choose to allow pain to place restrictions on our lives, to upset us and make us tense, stressed, and depressed. Or we can choose to accept that we have pain and then decide to do something about it. If we choose option 2, then we have started to self-manage. Self-management is very important when you are trying to change aspects of your life. Sometimes it feels like pain controls our lives. If we keep waiting for something to change, we are placing our lives on hold. Self-management strategies can stop the waiting and enable us to take charge, to make changes ourselves. We can learn to return to a function-centered life. This image illustrates how we can become caught up in a cycle of pain that can start to control how we live our lives. It is a vicious circle. When you live a pain-centered life, you limit your activities, which causes muscles to weaken and tighten and leads to physical deconditioning, which can cause you to withdraw from social activities and lead to anxiety, depression, and anger. Then, to start the cycle again, you limit your activities. With self-management, we can begin to move from a pain-centered life and start creating a function-centered life. You learn active coping measures and self-management skills, giving you the confidence to increase your activity, which ignites a physical reconditioning. This drives you to put yourself out there and rejoin social activities. This leads to an improved mood and overall sense of well-being as you continue to practice self-management and living a function-centered life. Now take a few minutes to watch Pain and Me, a refresher video that you will recognize from the orientation presentation. Pain and Me illustrates how we can lead productive lives despite pain-related changes. The video can be found at the addresses on the screen. Press play on this video when you are ready to continue. These are some of the self-management tools that you will learn about in the Persistent Pain Program. We have healthcare providers and classes that address these strategies. You will learn about posture and pacing, physical activity, sleep, medications, healthy nutrition, mindfulness, self-talk, relaxation, and communication. Pacing and posture. Improper posture can lead to muscle imbalances, restriction of movement at various joints, poor movement patterns, trigger point development, and pain. By learning how to improve your posture and pace your activities, you can help to relieve muscle tension, improve your movement, and decrease your pain. Some of the classes we offer to target posture and pacing are the Pacing and Posture class and Introduction to Exercise. We also offer a trigger point class if trigger points are contributing to or are a result of poor posture. You will learn techniques you can use at home to relieve these tight muscles. Physical activity is an important and versatile tool in your persistent pain toolkit. Physical activity releases endorphins, natural painkillers, and feel-good hormones. Physical activity lubricates joints and tissues, and the increased blood flow means more oxygen and nutrients are getting to muscles and tissues, resulting in decreased stress and anxiety. Studies and patient self-reporting show that daytime physical activity leads to improved sleep quality. Why is sleep important? Our productivity and behavior can be negatively affected if we don't get enough restorative sleep. Sleep plays an important role in our personal health, and the connection between better sleep and lower pain is well demonstrated. We need adequate sleep quality and sleep quantity. Sometimes a step towards self-management is deciding to use medication. Some people start with over-the-counter medications, while some start with a prescription. Some meds can target pain by improving our baseline mood so the pain won't bother us as much. Knowing when to use medication is also key. Medications are most helpful if they are used as prescribed or as directed on the package. Many people with persistent pain use medications for various reasons. However, the majority of pain medications don't reduce the amount of pain. They only change our perception of it. Proper nutrition is also an important tool in the management of persistent pain. Proper nutrition supports maintenance and repair of cells, muscle, and tissue. Proper nutrition supports immune system function, increases energy levels, improves mental health, and supports regular bowel movements. Irregular bowel movements can contribute to back pain, gastrointestinal discomfort, and migraine headaches. Proper nutrition is also important in the management of other health conditions and is essential for disease prevention. Eating a diet high in processed, pre-made, or fast food without getting enough fiber, fruits and vegetables, and healthy carbohydrates and proteins can lead to a generalized feeling of malaise. Mindfulness is another of the many tools you can keep in your persistent pain toolkit. It is a term you hear a lot these days. But what is it exactly? Mindfulness is about being here, now, in the present moment. While the idea is really very simple, embodying mindfulness is not always easy. We've all had experiences of being completely absorbed in what we are doing. Perhaps we're taking a walk on the beach, playing with a child, looking up at a magnificent sunset, or enjoying the first bite of a delicious meal. These moments are moments of mindful awareness, and we have them all the time. It's just that they are brief and fleeting. Practicing mindfulness is really about stretching out these moments of present focused awareness by training our minds to keep coming back to what is happening right now. Mindfulness can reduce pain, stress, and healthcare visits. It can reduce anxiety, improve sleep, help with depression, and lower your blood pressure and pulse. There are many forms of mindfulness practice, like meditation, yoga, or making art or music. Take a few moments now to watch yoga and meditation. This video shows how patients at a pain clinic in Australia have successfully been using some of the techniques we have been discussing. You can find the video at the addresses on the screen. Note: stop the video at 2 minutes and 3 seconds, as the information that follows does not relate or apply to the Grande Prairie PCN Persistent Pain Program. Take as much time as you need. Press play on this video when you're ready to continue. Self-talk can be an important tool in the battle against persistent pain. It is our inner voice, and it's what we say to ourselves in response to situations. Self-talk generates and perpetuates our emotions, and can be positive or negative. Self-talk is the most powerful form of communication because it either empowers you or defeats you. We all engage in self-talk. Negative self-talk is often irrational, distorted, and inaccurate. It can lead to feelings of helplessness and defeat. Changing the way you talk to yourself can change your emotions and even your actions. We have several classes that address this issue, including the self-talk class, happiness basics, and anxiety to calm. Relaxation is the purposeful use of techniques which are used to create the relaxation response in the body. Relaxation can reduce muscle tension and spasms. It can help reduce stress and help calm you during episodes of increased pain. Types of relaxation include breathing, visualization, and progressive relaxation. When we refer to relaxation, we want to ensure you understand that the practice of relaxation is much different from leisure activities or entertainment. The Persistent Pain program offers a class in relaxation. To help you manage pain, you need to regularly communicate your needs and limits to others. You may feel like other people, such as family, friends, co-workers, or healthcare professionals, do not understand your experiences with persistent pain. By using effective communication, you can help others understand the impact of persistent pain and the importance of making changes to your ability to cope. Effective communication usually invites the best response from others. Effective communication can help build and improve relationships. Take a few moments now to watch the video, A Guide to Effective Communication. You can find the video at the address on the screen. When you are ready, press play on this video to continue. Self-management goals. When choosing a self-management goal, there are some things to keep in mind. You want to improve and/or maintain function. Start with the issue that interferes most. Focus on changing your response to pain. Address the secondary consequences of pain. It's okay if your goals change. Don't be afraid to try something new. And remember to ask for help if you need it. Changing our thoughts can be one of the hardest things to do. Sometimes, all we can control is how we react to something. Reactions usually start with our thoughts. By changing our thoughts, we can change our emotions, change our mood, and change our actions. Learning self-management techniques and choosing to implement them into our daily lives can be a struggle too. Self-management tools can help us regain control of our thoughts, emotions, and reduce stress. We can then move forward with our lives. We can start doing instead of waiting. The next steps for you in the Persistent Pain program are to sign up for groups and workshops and to book individual provider appointments. Some things to think about before moving forward. Feel free to write them down and bring them to your case manager to discuss. What did you learn today? What stands out for you? Or what can you relate to? Do you have any unanswered questions? What do you want to know more about? Are you ready for the next step of booking a group appointment, workshop, or provider appointment? If you feel ready, call 780-539-9204 to register for a class to learn about some of the tools and strategies put forward today. If you are still unsure, speak to your case manager to get some advice. This has been Pain Education, How to Manage Pain, part of the Grande Prairie Primary Care Network Persistent Pain Program.